They're called NSAIDs for non-steroidal anti-inflammatory drugs, and millions of Americans take them every day. Over-the-counter painkillers like ibuprofen and naproxen. But new research finds that high doses of these drugs can increase the risk of stroke or heart attack. Here with more is Dr. Tara Narula, Associate Director of the Cardiac Care Unit at Lenox Hill Hospital here in New York City. Good morning.
Good morning.
These are common drugs that many people take, right? What are we talking about?
So we're talking about common drugs like Motrin or Advil, Celebrex, Voltaren, things like that. That's how you would know them.
So looking at that list, like Anthony mentioned, so many people are taking this. What do they need to know about taking this drug regularly and what it could do to their heart?
So over-the-counter medications have side effects. In particular, with this class, we worry about kidney problems, stomach ulcers and bleeding, and the most dreaded is cardiovascular problems like heart attack and stroke. So with these medications, what we found is that in high doses, they can actually increase the risk of heart attack.
What does high doses mean? How many people are taking high doses, do we think?
We're talking about patients who have chronic pain and inflammatory conditions like osteoarthritis and rheumatoid arthritis, and these doses are prescription level or 2 to 3 times what would be the maximum recommended dose on your over-the-counter label.
So in 2004, we saw brands like Vioxx, Bextra, Celebrex. They were all pulled from the market for fear of heart attack, for fear of strokes. Why are the current brands on the market as dangerous as these? I mean, could we see them being removed also?
So that's very possible. The latest research looked at several 100,000 patients, 300,000. And what they found is that if 1,000 patients take this medication for a year, 3 of them are at risk of having a heart attack, one of which could be fatal. So these medications taken in high doses can be exactly as risky and dangerous as the medications that were removed from the market.
Are there safer alternatives then?
There are other alternatives, at least for pain relief. We think about medicines like Tylenol and also opioid derivatives like morphine, but of course those come with side effects as well.
So for the people who have chronic pain, who have to take something, what should they really know about the dosage that they're giving themselves and what it could do to them?
The bottom line is if you have chronic pain and you require high doses of NSAIDs, you need to speak to your doctor to find out what your risk is and also to control any underlying risk factors that you might have for cardiovascular disease like high blood pressure, high cholesterol, diabetes.
Are the new warnings on these drugs saying that they were more dangerous than we thought, effectively?
They are saying that we knew that they were dangerous. We've known this for a long time. What we didn't know is how dangerous. So this new research shows us what exactly the risk is, and we now know that taken in high doses, they're very dangerous.
So all of these are obviously being used by people to treat inflammation. You talk about a lot of the alternatives, what other things people can do. Is there anything else they can do aside from reaching for a pill?
Obviously, there heat and ice and physical therapy. I mean, these would be other things that are not medical that you could potentially try.
Certainly is some good information for people to keep in mind. Dr. Tara Narula, thank you.